So what our research shows is that when people are confronted with counter-attitudinal information, that it doesn't always work the way that we would like. So an example from a study that Brendan Nyhan and I did is that when conservatives in the United States were given information saying that Iraq didn't have weapons of mass destruction, that among that group it actually led them to believe even more strongly that Iraq had weapons of mass destruction. So the corrective information in this instance actually pushed people in the wrong direction. And we've seen something similar with the vaccines. So we've done a couple of studies. We've done one that looked at attitudes towards whether the MMR vaccine causes autism, and so efforts to correct that and say, look, that there's lots of evidence. This is one of the most researched questions in vaccines, and there's no link whatsoever between the two. And when we give people who are resistant to vaccines and have negative attitudes towards vaccines, that it doesn't actually move them in the direction that we would want, that they become more accepting of vaccines, that actually among that group that's least favorable to vaccines, they become more likely to say that they won't vaccinate future children. They become less likely to say that they will vaccinate future children. And we've seen a similar result in doing a study about attitudes about the flu vaccine. So the myth here that we're correcting is whether or not you can get the flu from the flu vaccine, which is a fairly commonly held belief. And we found exactly the same thing, which is when we gave people corrective information and we tried to say that you can't get the flu from the flu vaccine, that the people who were most reluctant to vaccinate in the first place, that this information actually decreased their likelihood to get the flu vaccine for the upcoming flu season. I think that it's not all doom and gloom, that these proportions of anti-vax populations are relatively small. So this is, again, these effects are concentrated in the people who are most opposed to vaccination in the first place. That the much larger segment of the public is vaccine supporting or sufficiently vaccine agnostic that they're willing to go along and are able to get vaccinated. Long term, in terms of being able to get the highest levels of vaccine compliance and maintain levels of herd immunity, this small group is obviously something we have to worry about, but the much bigger picture is that we still have fairly high levels of vaccine, very high levels of vaccine compliance. Now, in particular areas, flu vaccine, HPV, vaccine compliance could and should be higher, and this is something that we'll continue to work on and try and understand the main drivers towards vaccines and how people respond to new vaccines as new vaccines come onto the market.